Please Home. That's the theme for our upcoming Women's End It Now Emphasis Day. So in preparation for that campaign, we took the liberty of inviting two women from the National Women's Commission, and they'll be sharing their knowledge and experience on domestic violence. Welcome to part one of that discussion. Good morning and welcome to another episode of Defining Your Health. I'm your host, Tracy Lewis, and with me, I have two very special invited guests from the National Women's Commission. Ms. Thea, can you introduce yourself?
Hello, good morning. My name is Thea Garcia Ramirez, and I am the president of the National Women's Commission.
Good morning. My name is Cynthia Williams. I'm the executive director of the National Women's Commission. Thank you for the invitation.
So we have the president and we have the executive director. Excellent. So this morning we have a lot of information laid out before us, and I want you to try to simplify it. I know there's so much here that we can talk about, but first things first, what is your organization about? What does it represent? What do you guys do?
Well, the National Women's Commission is a policy advisory to government. But in simple words, basically what we do is we look at the work that is being implemented on the ground as it relates to gender equality, equity, and women's empowerment. And we work closely with the stakeholders. These include both government and non-government. And then we make recommendations to government on how to improve the responses to these issues that I mentioned. And so we work with a board who is appointed. Ms. Thea, she said, is the president, and she works closely along with 12 other commissioners from areas around the country. So we're very well represented.
All right. So you mentioned three things. You are interested in gender equality,
gender equity, and women's empowerment.
Gender equity and women's empowerment. Before we move on, can you simplify that a little bit for me? What is gender equality? What's gender equity? And what do you mean by empowerment?
Right. The work that the commission does is really to help not only government, not only service providers, and just organizations and a whole, both private and government, to really look at the work that is being done and how does it affect women and men? How does the lives of men and women are improved? And how the challenges that men and women have in their daily lives can also affect the way that they interact within their families, within other systems, including government. But when we look at the issues of gender, we speak about the way that the norms and attitudes and values that we hold as to where women and men should be and what actions, what they're supposed to behave, and the roles that they're supposed to take in society, and how those influence positively and negatively their lives, so that then we see other issues affecting them.
Interesting. That's an powerful recognition. So, Ms. Thea, can you tell me what led to maybe the development of one of the first Women's Commission, and how were you established?
Well, I think there's government saw the need because women, as Cynthia has said, are disproportionately affected, and I mean negatively affected, in a series of manners in our daily lives. Like, for example, gender-based violence or domestic violence affects women more than it affects men. That's not to say that within households in Belize that there is not domestic violence targeted at men or aimed at men. It's just that it is more often targeted at the women in the families. And so we have disparity in also in pay. Women and men holding the same posts, having the same qualifications, but men are paid differently than women are. More likely than not, usually men are paid higher for the same work that women do. Women are paid less. And so these are the things that the commission looks at, that the government saw that there was a need to have a commission that would recognize the needs and advocate and develop policies and advise government how it is that we can eliminate these forms of discrimination against women. For example, women have have different and unique issues in health, for example,
Uh-huh.
and a woman's health impacts the health of her children and of babies. And so we have a series of needs and wants and priorities that we have to look at, and that the Women's Commission seeks to advocate for, seeks to have people more aware. So we advocate, we bring awareness, and we develop policy, and we give advice to the Minister of Human Development, in this case, Human Development, Families, and
Indigenous
Indigenous
Peoples Affairs.
Peoples Affairs. And so we are a policy and advocacy group. As Cynthia says, we have 13 commissioners, myself included, and I'm happy to say that for the first time that I can recall, we have 3 men
Oh, wow.
in the commission. And that is important because the fight for equality, for women's rights, is a fight that is not only for women, women for women, but it also has to bring in the brothers and the men, fathers, brothers, and everybody, and say to them, our fight is also your fight. It's for human rights. It is my father, my brother, my grandfather, my uncles fighting that I should have the same rights as they have. That if I work, that I should get the same pay they get, and that my place in society and in this country is no less than their place. And so we must bring in the men also for this fight in for justice and equality for women in Belize.
I love that our place is not less. You
Exactly.
mentioned a number of issues just now. Is there what would you call some priority areas right now or concerns?
Well, I think the primary concern right now is domestic violence. As you know, um, the pandemic has shown a lot of cracks in society, has augmented them, has shown us where the weaknesses are, and being close together and hooked up, and because it the pandemic has put a lot of pressure on our families. So a lot of the problems have been augmented, and regrettably, domestic violence is one of those things that have reared out of control because of the close proximity, because of the socioeconomic pressures that families are going through. You know, when there's no jobs, unfortunately, it detonates a little like a domino effect. People turn to drinking and drugs more to cope with the pressures. Um, there's less employment, and that is another problem and creates another pressure. So then you put all these people in sometimes very close spaces, overcrowding, and that is another pressure. And it doesn't end well for a lot of women and children mostly. And I'm not saying that men are not victims of domestic violence, but most often than not, it is the female that and the girl children that feel the brunt of all of these social ills. And so at the forefront, we advocate for a lot of different issues, but we would like to highlight on this occasion, and hopefully you will have us back
Definitely.
to speak on other topics. But we would like to focus today on domestic violence as a whole.
Excellent. Miss Cynthia, it seemed you wanted to add something just now.
Yeah, I definitely, I think Ms. Thea definitely highlighted one of the areas that we work with. Our two main guiding documents in say, or the work that we do is based on really carrying out work that is outlined within the policies that are developed in partnership with other organizations and other government entities. I think that's one of the things that the commission as a body, as a policy advisory body to government, is also a coordinating mechanism that where we try and bring in all the different stakeholders that work in similar areas in the social area to look at what they're doing and how these all combine. Because at the end of the day, the question is, are we doing the same work? Are we trying to better the lives of women and girls and their families as well, which include men. And by that, there are 5 areas that are outlined in the National Gender Policy, which are looking at health, education, wealth and employment. Gender-based violence is, of course, one of them, as well as women and decision making, and of course, looking at how do we strengthen organizational systems, because we need to really work together to ensure that we are speaking the same language. And in speaking the same language, that the language that we speak also is the one that the people that we're serving are the ones that are speaking.
Right.
So the commission has really, since 1982, and it was actually the first time that the commission was formed, really trying to see how to make that connection between the policy level and the actual programs that are developed and the people that are the recipients of those programs. Because it doesn't make sense for all these policies to be developed and in the end, they're not really impacting the people the way that they're supposed to be impacting it. And because of the nature of what we work with, which is the way we are socialized, the things that we think about, we will never really be able to deal with issues of violence or similar issues within the social sector if we're not able to really help people, men and women, understand the importance of accepting each other and seeing themselves equally. And when we talk about equally, often we are asked, well, men and women are different. And of course, men and women are different. Biologically, we are. But I think at the end of the day, our society has evolved to a point that even economically, as Ms. Thea mentioned, there are so many other issues where both of them are in need of going outside. So we have to learn to be able to manage the things and the duties and responsibilities that we all have with each other, and so sometimes what happens is the expectation that those roles and those responsibilities in the past were mainly for women. Then that's where sometimes problems comes in, because then we have the double burden that often women find themselves, where they work outside of the home and then they still have all the work that they have to do inside the home. And often when we enter into these type of discussions, we say, well, that's how it used to be, that's how it needs to remain. But the truth of the matter is that we can't keep on living like that, because the health of women are affected. And like what Ms. Thea said, when women's health are affected, the entire family is affected. When women's employment and economic inclusion, financial inclusion is affected, the families are affected. And, this is not only something that happens in Belize, this is a worldwide issue. Well, many areas in Belize, we are doing much better than other countries in the Caribbean or in the world. We still are having the same issues, because at the end and at the core of it is being able to deal with the nature, which is the position that we have men and women in. And unfortunately, women are a bit lower on the scale, or a lot lower in the scale.
You're touching
many
so
times.
many things. You're touching so many things, Ms. Cynthia. But you said something very interesting, and I can see that advocacy is coming out a lot. That you're a policy, you play a policy advisory role and a coordinating component. Because I'm thinking now, you said women have these issues. So when I have an issue as a woman, do I go to the National Women's Commission if my kids are hungry and I'm having issues with the husband at home and I need food, or I need a grocery, or I need, so you mentioned that you work along with a number of other stakeholders. So can you tell us a little bit about some of those pathways for assistance, or how we get access to these
Definitely.
services?
Definitely. Well, first of all, I think one of the things that we always help people understand is where we are situated as a commission. We are within the Ministry of Human Development, as Ms. Thea said, but we work very closely with the Women and Family Support Department, that is the direct service provider of support to women and their families. So while people might come to us, we do a lot of referrals. We don't provide direct services. We do implement programs where we have interaction with the communities, but don't provide any concrete service, because at the end we are a policy advisory body. But we work very closely with other organizations, other ministries. We work with NGOs, so for example, Red International, YWCA. We also work with the Belize Crime Observatory, that is an institution that deals specifically with data and gathering incidents and recording the data that we need. Because when you formulate policies, when you formulate programs, you can't just take that out of thin air. You formulate them based on data, on what the numbers are saying. And while we have seen, for example, last year, at the onset of COVID, we did see a rise in between April and June.
April and June.
April
A
and June
rise.
last year in terms of reports
Of
of
domestic
cases. So while
violence.
domestic
Okay.
violence. And we specifically mentioned domestic violence because when we speak about gender-based violence, domestic violence is only one form. It's an umbrella of multiple forms of violence. When we talk about rape, we talk about sexual harassment, we talk about femicide, we talk about domestic violence. So domestic is only one form of violence that is experienced in our communities. And all of those issues we also work with in terms of the other organizations in the community. And so we have developed systems. For example, last year we developed the gender-based referral pathway that we brought some copies here. And what it did is really outline the process and the different places that people can go to whenever they are finding themselves in those situations: health, police, the courts, and of course human development. And then we felt that we need to go more into that, because then people still are looking at it and say, well, it's complicated, and we made it a friendly version in terms of helping people to understand where all the places that they can go to. And so those are some of the things that we do in terms of partnering with other people and ensuring that people are getting the information.
Okay. But just before you go into that, Ms. Thea, you mentioned that there was a rise between April and June last year at the onset of after the onset of COVID. So has there been any new policies, or has it been like extra enforcement of a specific policy since that rise?
Well, for example, the pathway that Ms. Cynthia was speaking of, for example, when we develop the pathway, it says specifically, for example, if a survivor of domestic violence reaches out, let us say to the police, uh, they're not in any immediate danger. And we always encourage survivors to report, whether or not you choose to at that point press charges or not. It is important to document. You might be feeling overwhelmed because maybe it has just happened. Make the report. You do not have to choose at that moment to press charges. You can take your time and say, okay, I will report, and have it there for future reference. I always encourage women, because while every case is different, and I know a lot of people say, oh, well, I don't understand why she stays in that relationship. I think it is important to understand and to try to empathize. If you have a friend in that situation, my advice, as having been in that situation myself, is that it is hard for somebody else to understand when they're not in this situation, because for me, at least, for instance, when I was in that situation, I didn't understand what I was doing in that relationship either. So how could you, as my friend, understand? But
Can I ask a question,
yes,
if you're willing to share? Because is it fair or true to say that some women don't know that they are in very abusive relationships? Like, how
well,
do you recognize that?
there's different forms of abuse, as Cynthia was saying. There's economic abuse, when you as a partner, as a wife in a family, the man or the person that is the breadwinner in that family says, well, I'm not going to give you the money, or you have to account for every single cent. And if they give you $10, you better come back with the receipt to prove where you spent that money. That is economic abuse. That is financial abuse. That's not a real partnership in a marriage. That's not what it was meant to be. When you withhold money or withhold that finance from a person as punishment for not getting your way, say, I want this, or I want that, or I want you to do such a thing, and if you don't, then I will not give you money for the groceries. That is financial abuse. There's psychological abuse as well. When you are told in a domestic partnership, and you are told, you know what, you are so fat, nobody will want you, only me. That is psychological abuse. When you are demeaned and you are humiliated, that is abuse. And so there's many forms of abuse. There is sexual abuse. A wife does not have to cohabitate with her husband. At any point in time, you can say, no, I do not want to have certain relationships with you. And if you are forced to do that, that is an abuse, that is sexual abuse within the context of marriage. You still have a choice. I don't believe that just because you are married, you have lost your identity and your will. You can still say, no, I have a headache. I don't feel like doing that today. So that is your choice. You still have a choice. And for example,
I'm smiling because it gets touchy when it comes in the context of Christians, because the overall perspective is that a wife should it's
submit.
I mean, we say the word submit, but there's an understanding that when God made Eve, He took a rib from his side, not from the feet for her to be trampled upon, or from above, so that she could be the head, but so that they were equal. And sometimes there's this misunderstanding, especially in Christian marriages, that there's a norm that abuse should be in there, especially economic, and some of the things you mentioned about being able to say no, and things like that. So
I think that if you're taking it within a religious context and a Christian context, if you came from the rib and you're equal and we are side by side, it is all things in a marriage, in a partnership, should be done in accordance with one another and with
And
respect, with
and
consent and respect.
I love that.
And so I don't think that what we are saying contravenes any Christian value at all, at all. And so when it comes to abuse and physical abuse and domestic abuse, it really, I believe, has no place in any marriage, let alone a Christian marriage.
Beautiful, beautiful.
And what I'm saying is, for example, when as a friend, I've had a friend that says, I don't understand why you stay. And I said to her, well, I don't understand it myself, so how can you? But as Christians, we are called to love our neighbor. And that is my commandment. That is my term of reference, if you will. I am not called or commanded to understand my neighbor or to agree with my neighbor. I'm simply called to love my neighbor as myself. And so I think that is one of the biggest and greatest commandments that we have. We are called to love our neighbor as ourselves. And within Christian marriages, I believe that is an even more important commandment.
I think it's in relation to the pathway. I'm noticing that we're talking about neighbors, and I see on your mask that you have here to call the GBV hotline. So how can you be that good neighbor? Like, what are some of the ways that we can help others to know about the service you provide, or for ourselves if we're in that relationship?
Right, definitely. Well, that's some of the work that the National Women's Commission has really tried in terms of developing, little promotional items that people can know about the hotline. The hotline has been in existence for quite a while. The issue of different forms of gender-based violence is nothing new to the case. I think one of the things that has hindered us is that we've chosen not to talk about many things because it has been in the confines of what we call privacy. And a lot of times, even when we talk about even families and relationships, well, we should not interfere because come next weekend, they'll still be there together. And that's why those are some of the hindrances, even for individuals in society, to say, well, that has nothing to do with me. And even in times when it touches on their door, when it's a family member, even to that point, sometimes it's not there. So the hotline is really to provide that immediate assistance when it's in need of danger situation, when their life is at risk, and when the well-being, the physical well-being of anyone in terms of domestic violence, particular sexual violence as well, even in terms of children. Anybody can call the hotline and request police support, because police is the only entity that is legally mandated to respond in those cases. And so the hotline is there, 0800, a way out for people to call. Neighbors can call, family members can call, children can call. And what we did last year at the onset of COVID, also we partnered with the United Nations Population Fund, UNFPA, where we provided an additional line, because what was happening is the original hotline was only for BTL subscribers. And we didn't realize it.
Oh
So what
my.
happened, it's toll free. Nobody has to have credit whenever you call the 0800 a way out. And we realized that those who were the smart customers did not have access to it free of cost. They had to have credit. So what we did is we then provided an additional line for the smart subscribers. So now everyone has free access to it. Whenever anybody calls 0800 a way out, then the police can respond. While the line goes only to Belize City, what we've been advised by the police department, whom we work closely with, is that they also liaise with their various counterparts in the districts, in the areas that they need to respond. But we increased it by adding a cell number to it now that has text component, because sometimes in danger, you know, the person might not be able, they can text, or they can send a WhatsApp message if they might have credit, you know, in terms of data. So those additional aspects of the hotline is what we're promoting now for people to know and be able to utilize it, because it doesn't matter if the person is going to go back to it. At least you've saved that life, you provided support in that instance. And studies do show that at least, and we're talking at least 8 attempts for someone to really leave.
Wow.
And some people never leave.
Wow. That's I didn't know about the hotline. The only hotline I've ever been heard and mostly promoted is the Crime Stoppers. So that's interesting that you said that, and we haven't touched so many things, but we're here where it's time to take a break. We'll be right back again with Miss Cynthia and Miss Thea, and we'll look a little bit more at some of the other pathways for services. So we'll be right back. Stay tuned.
A study published in the Journal of the American Dietetic Association found that toddlers aged 12 months and older consumed a third of their daily calories from snacking between meals, with the snacks becoming less nutritious as the children got older. Dietary patterns low in fruits and veggies and high in sweets and saturated fats began to develop between the ages of 12 months and 24 months, and this pattern tended to be established by 24 months. That's a fact. But there's hope. Parents can establish the foundation for a healthy diet early in life when eating habits and preferences are being formed. Simple dietary changes, such as offering more nutritious snacks, can help prevent obesity and chronic disease in our children. So switch the gummy bear for blueberries and see them growing healthier and happier.
Hi, my name is Amini Anderson, and I'm the General Manager for our Yadpa bookstore here in Belize City. At our bookstore, we cater at offering books that can help you live a healthier lifestyle. We offer books that can help your marriage and your family life to be even more sweeter. We haven't forgotten the kids, we have books for them, and we also have books that will help you grow in your spiritual life. We're located inside the headquarters of the Belize Union of Seventh-day Adventists that is located on 3A Street, Kings Park. Our phone numbers are 223-3048, or you can get us on our cell number at 660-2378. Our working hours are from 8 to 12:15 from Monday to Thursday, 1 to 4:15, and on Friday, we're open from 8 to 12. You can also find us on Facebook. Our name for our page is Yadpa Belize. ATN has partnered with us, and for every purchase made using the code ATN21, a proceed will be going to them to help them further in their ministry as well. So feel free, come visit us. I'm sure you're going to find something that will be a blessing to you all. Thank you.
Putting God first can be difficult. What can we learn from Daniel that will help us put God first in our lives today? Daniel was a young man when he was taken into captivity to Babylon, capital of the greatest empire the world had ever seen. King Nebuchadnezzar always took the best and brightest young men as captives from the many nations he conquered. He would then teach them the Babylonian science and religion, knowing that they would significantly contribute to the expansion of his kingdom. 10,000 young people were taken along with Daniel, and from them, the best of the best were sent to the palace. Daniel, Shadrach, Meshach, and Abednego were some of these. Their first test was with food. In fact, since the time of Eden, God's people have been tested with food. Food has been a representation of either devotion to God or rejection of His word. But in their case, putting God first could have cost them all the privileges afforded them, or worse, they could lose their lives. However, these young men decided to put God first, no matter what happened. They couldn't be forced or bribed to do otherwise. Faithfulness with their diets not only gave them superior physical strength, but, most importantly, greater mental and spiritual discernment. So, it was not by chance that they became the top students in the Babylon University. Later, Daniel would be put in charge of all other scientists, while his three friends would eventually become the top leaders of Babylon's capital city. All this because they decided to put God first. Shadrach, Meshach, and Abednego were willing to be burnt alive rather than compromise. They said, "If we are thrown into the blazing furnace, the God we serve is able to deliver us from it, and He will deliver us. But even if He does not, we want you to know, Your Majesty, we will not serve your gods or worship the image of gold you have set up." As an older man, Daniel would rather be thrown into a den of lions than to stop praying first thing in the morning. But God came through again, and Daniel lived to praise Him and become the prime minister of Babylon. Daniel put God first. His example compels us to do the same. As the deacons collect the tithe and promise, we are challenged to put God first.
Abigail.
Yes, Gran?
Abigail, I can't breathe well.
Granny, we need to go to the hospital to get you checked out.
No! I'm fine.
Yes, Gran, we need to go now to get you treated. Now, before it's too late.
No, 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 no.
Grandma, we need to go for all of us.
No, no, no.
Stop.
If you are having flu-like symptoms, please call us immediately for medical guidance. If you have chronic conditions such as diabetes and you are experiencing symptoms such as shortness of breath or chest pain, please also seek medical attention immediately. We lost a lot of people this year. We don't want to lose you too. Please seek help if necessary. Call us at 0800-664-2273. Continue to wear your mask at all times. Keep physical distance when in public and stay at home unless absolutely necessary. This message has been brought to you by the Ministry of Health and Wellness.
Welcome back to Defining Your Health. We have on set with us this morning two special women from the National Women's Commission, Ms. Thea Garcia Ramirez, the president, and Ms. Cynthia Williams. So we were discussing, I almost didn't want to go to the break. I was rattling off and listening to these ladies. So it's been such a blessing to have you here to have this discussion. But we were talking about being a good neighbor, and that women sometimes they might take several attempts to reach out for help. 8, I think we mentioned, and so I was hoping that you could share some of the ways that or the pathways that women go through to get that assistance that they're seeking.
As you were saying, it often takes several attempts, and on average, it's about 8 attempts for a woman to finally decide to leave an abusive situation. Uh, and we have this is our pathway in Spanish. We also have this available in English, but it says that there's different points that people might reach out for different services and different. For example, if you're a survivor of rape, your immediate need might be to go to the hospital, and then we channel you through the different needs you may have, psychosocial help. You may need medical attention. You may need help or protection from the police. And these are all the stakeholders and or frontline workers that deal with survivors of abuse. And like we were speaking before, there are many types of abuse, many types of violence against women. Some are psychological, some are even financial, and some are sexual and physical abuse, domestic violence. And so each one of those types of abuses has a different effect. And so, for example, some women that have been financially abused have no control or say over any kind of expense or money and are being stopped from working and that sort of thing, might need to provide pantry and assistance for housing, and all of that is within this pathway.
Okay, I didn't know we
Yes.
could get help.
And I think one of the important thing to remember is that often, when we speak about these issues, their immediate response for some people is resistance to believe that these things are happening, primarily because often we really don't want to accept that we as individuals are capable of such type of violence. And some forms of violence, you don't see anything when we talk about the emotional component and the psychological component. That really takes a long time for people to no longer see themselves even as a human person. And for someone to do that, it takes quite a lot. And so when we talk about abuse, it is about removing that choice and removing that opportunity for that person to make decisions, even on the most basic aspects of their lives. And so it's important for us as individuals to be reflectful and be able to try and not to normalize certain actions that we normally have, because that's what we've been raised. We've taken some very small actions and termed them as disrespectful because maybe someone wants to voice out their opinion. And so we have to really, even as ourselves, begin examining what are the things that we are doing to perpetuate these messages that don't allow women to really develop into who they are. When we mold our girls in a way that they become the need of protection when they're on their own, they can't do it themselves. We are interdependent with one another, but at the same time, we have to recognize that unfortunately, our society has grown and there are so many dangers that we need to protect both boys and girls. Because before we used to say, well, we only need to protect girls because they're the ones who need protection. But we've recognized that boys are also going through a lot of types of abuse. And before, even legally, women and boys were not even protected. So now that has changed, because we recognize that boys are facing a lot of dangers sexually as well in terms of what's going on. And so like when we develop this type of images, is really to help people understand, to know where they need to go. And even if they go to the court and they don't want to do anything at the court has the legal obligation to provide at least information. So at any point, if they go to the police, they go to the health aspect, any clinic, they go to the Women and Family Support Department, any human development office, if the services that the person is requiring, they don't have it or it's not within them, they are legally mandated to refer them to another entity. Just don't send them out and tell them, well, we don't do it. We don't do that yet. And so this is the purpose of the commission, recognizing that these are the gaps in the system and then helping frontline persons, because at the end of the day, a police officer is a human being just like you and I, with the same values or worse values and attitudes that you and I have. And so our own biases will be reflected sometimes. And so we're doing training with the police to help them understand, I don't care if you believe that the woman's place is in the kitchen. when the woman goes and make a report, or if a man goes to make a report, you're not to laugh at that person, because that is his duty to ensure that he's reporting, and it's your duty, your job. That's what you're being paid for, to ensure that you provide the adequate response. And so these processes are hopefully helping people recognize what is available for them, what are their rights, for them to be able to access these services around the country. While we don't have that many that we would hope and love to have, we do have a lot of services. And so when something is not working within these processes, the National Women's Commission developed the gender-based violence complaint system. And what that does is helping people to fill a complaint that sends to us. It's not sent to the duty bearers, to the organizations that provide services. And then we deal with it. We make sure if it's a health issue, we say, okay, this is what's going on. This is not what it's supposed to be. Deal with it, remedy it. And we give them some time, of course, to deal with it. If they don't, it is our duty then to take it up higher up, as highest as we need, to ensure that the person does not go through that issue, that services are provided effectively, timely, and ensure that their human dignity is at the front. Because sometimes we like to really make people feel even worse. It's already, they feel shame having to go and report and say, my partner, my husband, my boyfriend is beating me, or and then for them to go through the humiliation of being laughed at or pointed out because they're accessing that right of service.
And I want, because this might be a little ambiguous, because as a policy advisory board, these are amazing graphics and information, but you said that they might not want to relive that constantly, and I hear you mentioning pathways and processes, but what are the services? How do I finally get to them? Because as somebody hearing this information, they might say, well, that's fine, but where do I go if I want help right now? Are you going to first the police station, and then that process, and then process? So
what it's saying is, if you don't know where to go, for example, and you don't know what services you want, when you're going through these situations, there's a lot of emotions, you're very confused. But let us just say that you end up
At the
because
police
you're
station.
hurt at the hospital. So you end up at the hospital. The hospital there will evaluate you. Okay, well, if you need stitches, okay, that's the first and that's the most immediate service that you need. They will provide that. At that point, they may say to you, do you feel like you need somebody to speak to? Do you think you want some support from a social worker? And if you say, yes, I think I do, they will call a social worker and say, we have somebody here that needs your services. And they will tell you there, okay, you have the services of the police available if you want to make a report. That doesn't mean that you have to make a report, but they're mandated to tell you what all the other services that are available, so that you know that these services are available. If you speak to the social worker and you say, if I go home because I have spoken to you or I have come to the hospital, I'm going to get another beating and I'm afraid to go home. Then the social service worker will say, okay, well, we will provide temporary housing for you. Where are your children? They're still back there. I need to go back. So then they will channel you through to the correct person to deal with the situation and help you and hold your hand through the processes. But we have to be very clear that it is the choice. It always respectful of the choice of the client or of the survivor. So if I am saying, I don't want the police involved because I don't know what I'm going to do yet, but I do need some help, at least so that I know what my choices are, that is okay. And we must remain very judgment free to say, I'm not going to judge this woman or this person because they are not strong enough yet to seek police action or to leave yet. Some people go in, get their stitches, and say, that's I don't want anything else, and go right back home because they're not ready. And it is not our place to judge when that person will be ready. And if they're not ready, no, they're not ready. All we try to do is to say to each and every survivor or person that is going through a situation of domestic abuse, there is help, We are here. We are standing ready. When you are ready for whatever services, we'll be here ready to give that assistance, ready to give that advice, ready to render that aid and that service. So it is when the survivor, when the victim is ready, and not a moment before. And all we are doing here is to say you have choices. There are things that we can do. There are services available for you. And what Cynthia was saying is very important. If you go to the police and you do not receive the service for your particular case, if you go to the health center and you are not adequately channeled and you ask for help and you're not given that, you can come and you can complain to the National Women's Commission. There's a form online through our webpage. You can contact us through our Facebook, through the messenger. Your information is completely confidential, and then we will take action and we will say, no man, what police station was that? The Ladyville police station. I was there at such a time, and such a PC took my information and laughed at me and said, man, uno go home. Uno stop get trouble. And then we will take matters into our hands and we will make the official complaint. So it's not you making a complaint, it is the National Women's Commission saying to the Compol, please talk to so and so, because we had somebody come in and the report was not taken, the issue was not referred correctly. And then there's a chance for the police, because a lot of times as well, Miss Cynthia, if we do not complain, people say, oh, everything is working fine. Everything's working fine in the health system, everything's working fine in the police department. Even social workers have their moments when, they're human too and they're overworked. They do not provide the service that they should. And so if we don't complain and raise our voices and say, they don't know that they need to do better, they don't know where their weaknesses are, they can't strengthen those weaknesses to make the system work. So it's important that if you're not satisfied, please look out for us, complain. We have a Facebook page, we have a web page, and we'll give you the information, and maybe you will do us the kind favor of providing that through your program so that people know that they can reach out to us.
I think one of the important things to remember is that we have to hold accountable persons. Not only, we can't hold accountable only the perpetrators, which unfortunately by vast majority continue to be men. We'll also have to hold accountable service providers. That's their role, that's their job. And that's what the gender-based violence complaint mechanism is trying to do, because as a people, we like to complain a lot, but we don't like to make it official. And that's the only way that things will change, if we document these things and say, if we are able to lodge all these complaints about a specific area, then it will be easier to make those changes that are required. And also because one of the things that often we say when we speak about violence, it is a choice. This is not how we operate. You make a choice. And a simple way of demonstrating is that even those who perpetrate violence against their wives and their children, they will not go and perpetrate violence about every single person that they meet. They will not do it at work. And so it is a choice that people make. Additionally, I think one of the things that we also have to remember is that we all have a responsibility in the work that we're doing. While the National Women's Commission is mandated to be the policy advisory, work on all these issues, there's also a role for the community to play. There's also the role of the church that they can play in determining how is it by the things that we tell our brothers and
Socialization.
and the way that we are socializing our children. Are we keeping them in those boxes that don't allow them to really see themselves as human beings, that their power of making decisions on their lives is being taken away?
I was just watching the news this week, and they're looking at the dropout rate for students, and I can imagine that a part of a number of students would be females, because since COVID and the students are home, more than likely it's the girls that are being asked to help with the cooking and the cleaning and all of that. And even though they get the packages.
And then what happened last year, one of the reports that the labor survey brought out, because again, we try to really look at data. when COVID, a lot of people lost their job. The employment rate increased. And while men's unemployment rate versus women's unemployment rates have been less, women have always been double, almost more than double of unemployed than men. Last year with COVID, the rate of unemployed men increased, but also did the women. They still were not the same. And what they found is that women, more than men, made the decision to actively stay home and take care of their children, take care of the house, take care of the sick, take care of the elderly. Again, those are norms that are influenced by our socialization, that are influenced by our cultural norms, that are influenced by our religious beliefs. There's nothing wrong in traditions. And I think often people misconstrue or misunderstand the role of the commission or the work of the human development in saying that they're there to break up families, because that's not the role. The role is to offer protection when it's needed, even if it's removal of children because their parents are unable to provide that protection, that care. The same thing with families, with women who might want to leave. We don't tell them, leave your husband. It is important to try and see how we can also provide programs for men as well, because they need to ensure that they begin to understand that with women advancing, it's not taking anything away from them. In fact, we need to be able to work closely together and see how together we can bring the family better. Together we can raise our children better.
So there are pathways for rehabilitation and reunification of families as well.
Well, there's a program that the National Women's Commission partners with ESCLAN, and actually Miss Cynthia is one of the people that gives that does the capacity building. And basically what ESCLAN does is that it works with young men and young boys. And because in the fight against domestic violence, we have to work along with those who are basically the perpetrators of that violence, to show them that even though we can see the correlation that if you grow up in a family where your father was violent towards your mother, as a male, you will, when you form your family, you will also feel like that is normal, and that is the kind of family that you will have. You will also be violent towards your wife. And basically it's been normalized in some parts of our society that, well, if your woman or your lady a couple, you slap her up, leave it, and you keep her under control, and that's the way that happens. So some people actually don't see it as wrong. They don't see it as bad behavior.
I never saw the effect until I saw it in front of me, when men hit their wives, and then the children are confused because this is my daddy and my daddy loves me, but he does this. And so again, you see when they grow up and they find a gentleman that they do that,
Well,
then it's easy to create an association.
That's why if little girls see their father hit their mummies, then they feel like that is something normal. So if my boyfriend or my husband hit me, well, nothing no wrong, because that's how my daddy did it with my mommy.
And he wasn't a terrible
No.
person. He bought me ice cream and he
Yes,
still
and-
provided for me.
And we tend to normalize a lot of things that shouldn't be normalized. There's a common saying out there that say, if you no beat me, you no love me. I'm sure you've heard that before, variations of that. And we say it smiling and laughing, but that is terrible. That is, you're not violent with anybody that you say you love. That's not the way you show love. But it is important that as women and as mothers, especially, we teach our young people, and we need to do it by example. We lead by example, we teach by example. Children will do what you show them, not what you tell them. And so if you're showing them one thing, doesn't matter what you say, you have to walk and talk, and and do and lead by example. So mothers have a big role to play. Because, for example, when you're saying oh, little boys should only do this sort of work and little girls should do this sort of work. But in my opinion and in my household, I have 2 boys and a girl. Cooking, cleaning, those
Both of
are
them.
activities that you teach as life skills. In the same way, a little girl needs to learn to cook, a little boy needs to learn to cook because both of them eat. And they both need to learn to clean because everybody must live, especially in these times, in a hygienic home. And if you want a car, my daughter knows how to check the oil and all the fluids because she drives, and so it's important. She knows how to change a tire. I'm not saying she will always want to do that, but she should know the same way because these are life skills that you teach any child, regardless of whether they're a boy or a girl.
And Miss Thea, just before you go on, and I wanted to get this in before we run out of time, but what are some of the things that, I noticed that you have this very interesting packages here, essential do's and don'ts.
Well, these are part of the